Okay, I think that we have everybody here, so we'll go ahead and get going. So again, welcome to our weekly news event with leaders from Indiana University, University Health, Monroe County, and the city of Bloomington. I am Chuck Carney, Director of Media Relations and spokesperson for Indiana University. And so we will have Mayor John Hamilton from the city of Bloomington here, Monroe County Commissioner Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, and Monroe County Emergency Management Director Allison Moore, and Kirk White, Indiana University Assistant Vice President for Strategic Partnerships. And so we will get going, first of all, with comments from Mayor Hamilton.
Thank you so much. You all hear me okay? I will, Chuck, thank you again for organizing all this. You do it so terrifically. I appreciate being with you. Just some quick updates. City Hall will be reopening to public presence on Tuesday, next business day. There will be a bunch of new protocols there. Masks will be required and pens will be given out as you sign in, and all the business will be done in some physically distanced new locations in the lobby. But for those, we strongly encourage people to continue to do business by phone and online. But for those who must do things in person, we do make that available starting Tuesday. Our Continuity of City Government group continues to meet as well on all our decisions and plans. People may have noticed things like canceled July 4th parade. Unfortunately, sorry to have to do that. Pools are not opening this weekend. We'll be reviewing if and when they can open safely. 2 work groups continue.
Well, I think it appears that Mayor Hamilton may have frozen up for everybody here, may have lost a connection there. So not unfreezing. So I'm going to send a message to him to, we'll come back to him. Let's go then to Julie. Why don't you go ahead and make some remarks?
Great. Thank you so much, Chuck, and thanks everyone for being here. Just a couple really quick things. Monroe County government is at our level 2. We continue to operate. So if anyone needs any assistance from any of our many departments, to please phone or email or visit the website. But we are currently keeping almost all of our buildings closed to the public as a way to protect public health and employee health. A big thank you again to all of the folks in the community who are wearing face coverings, and just think about who you're wearing them for. It's not for you, it's to protect others, because you may be an asymptomatic carrier. And so it's an important thing to remember who you're wearing your mask for. So we'll be posting some things on social media about that. Just a quick update about our food and beverage grant program. We've now granted money to 24 businesses in the county outside the city, which are tourism related, for a total of $192,400. Also, a big thank you to our healthcare workers and first responders. And I just want to note for folks in the community who may not be aware, this group, members of this group have been working diligently from the very beginning. And I just want to thank everyone who's been part of that, because that communication has really helped us protect our community, and that's the goal here. So thanks everybody, and let's remember those we've lost for Memorial Day. It's an important time to remember, and although there won't be any official programs this year, it's important to take a moment to remember those who have lost loved ones, the lives that we've lost in protecting our country. So thank you, everyone, and have a great weekend, and I'll be here for questions. Thanks.
All right, thanks, Julie. Mayor Hamilton, that was an excellent start. We'll give you another go. Got to unmute, though.
One of those things, sorry about that. If my screen went blank, so sorry. The only, let's see, I would think I was just mentioning the two working groups were underway on social services and economic stabilization. They've been very active for 60 days now, and they're kind of shifting into, I would say, beyond the millions of dollars they've helped coordinate. They've kind of are shifting into the recovery and restoration efforts very shortly. I'm sorry I missed, but I know the governor orders may have been mentioned already. I won't go in details on those. Doing it 2 days early, moving into stage 3 for 90 counties, not including our 88 counties, sorry, not including ours and 3 others. Allowing 100-person social gatherings, gyms and fitness centers, playgrounds, pools, no movie theaters. I am concerned about the speed of that, but I also will note, and importantly, that the state has extended protections from utility shutoffs and evictions and foreclosures through to July 1st, which is very important, and locally we'll be working hard on that, and also continues to allow local governments to impose tighter restrictions as we need to. Last thing I'll just note, I put out a speech today. I call it 10 tough weeks. It's hard to believe it's only been 10 tough weeks, but that's how long it's been since the pandemic was declared. And if anybody wants to see that, I kind of try to summarize some of what's going on here and what's coming up in front of us. Links on our website and social media. Maybe I'll throw the link in the chat room here. But thanks all, and I'll take questions. Thanks for everybody for all the good work.
Okay, next we'll go to Brian Shockney.
Yes, thank you, Chuck, for all your work, and thank you to our community who continues to do the right things. As Julie said, we do want to pause here on Memorial Day. You know, we're used to saying, let's be safe when we travel on these high travel times, and it has a new meaning this Memorial Day, as we want to be safe in our practices as we have this virus among us still. We at the hospital continue to see our numbers where we're down to 1 unit. Remember, we were up to 4 units at one time with COVID patients, and we discharged this week our 100th patient. We've seen much more than that, some still in the hospital, but we celebrated the 100th patient that was discharged from the hospital this week. So it was a great celebration for our team and for the patient as well. So we just want to be sure that everyone knows that we're keeping our facilities safe. If you want to come and receive healthcare in our emergency departments and our clinics that are reopening, all of our outpatient centers that are reopening, you are very safe there. We have all of our practices for cleaning. Everyone's wearing masks. Everyone's following the proper protocols. And you're safer there than you are in the community at Walmart or somewhere else. And so we encourage people to do that. For those who are still concerned about seeking healthcare and healthcare facilities, we have the virtual visits for the clinics. Remember, we went from 6 a week 10 weeks ago to now we're doing over 1,500 virtual visits per day. So our community is enjoying that, and we're enjoying that as well. I got to sit in on one and with the patient and witness it, and it was a very good visit between the provider and the patient, and goes very well. But please know that we are open for business in almost all of our areas by June 8th. Every clinic, every outpatient site, and every service will be back online here in the South Central region, not only Bloomington Hospital and the Southern Indiana physicians, but all of our regional sites here in this South Central region. I also want to just, I would be reticent to not name the pledge that we went over last Friday. As we head into this Memorial Day and people are getting out and seeing people, we want to be sure that you're paying attention to the pledge, to be sure that you're maintaining 6 feet of social distance when you're inside and not wearing a mask. You're washing your hands for at least 20 seconds, wearing a face mask when in public and close to others, staying home when you're sick, and getting tested. And the IU Health app is available. You can call, you can click on the website and go to the IU Health website and get screened and tested as well. And the last thing I want to say is that as we ramp up our operations here, there's been throughout this COVID pandemic an issue with blood supply. And so we are good right now, but we are continuing to ramp up our procedures as our other healthcare facilities around the state of Indiana. And so we want to encourage you to donate blood. The summer is a very typical time when blood donations are low because people are out and about on vacation, get out of their routine of donating. And just know that one donation can save up to 3 lives. So we just ask that you would contact your local blood donation organizations, Red Cross. You can go out and search for areas that you can donate here in our region, and we would strongly encourage you to do so. And with that, I'll conclude my comments and take any questions later. Thank you.
Okay. Thanks very much, Brian. Next, go to Penny Caudle.
Good afternoon. Thank you. And I too remind us that it is Memorial Day, and we want to remember those who sacrificed for us. Also, along with that, Governor Holcomb announced that he's ordered flags to be flown at half-staff on the 24th in honor of those who have died from COVID-19. The governor did release a new executive order yesterday. It's Executive Order 2028. It does move most of Indiana into stage 3, although he did change a few things from the projected plan. Now, keeping that in mind, the Monroe County Health Order does continue through May 31st. So our county is not yet in stage 3. A new local order will be released next week by the health officer. So with that, a few questions that we've received that I will just remind people what that means. Campgrounds, Little League practices and games, gyms are not yet allowed to open because we are in stage 2, if you will, of the state's plan. We have not yet moved to stage 3. Some of the things that the governor's order changed, and just some of the things that remain closed per the governor are playgrounds, movie theaters, festivals, fairs, parades, overnight camps, bars and nightclubs, amusement type parks. All of those things remain closed for the time being. We know that questions come up daily. We get questions. We think of questions that we have as we look at guidance and we try to provide guidance to individuals. Things change daily, and we have multiple staff who are working to help answer questions. And because we have multiple staff doing that, it can be very, very tricky. So we do understand that it is difficult to kind of keep track, but do reference the Monroe County order that is in effect, as well as the governor's orders. As we look at our numbers and our indicators for moving forward for Monroe County, the COVID-like illnesses, the influenza-like illnesses still continue to go down. Testing over Indiana is increasing greatly, including Monroe County. Indiana has now over 200 testing sites, and those can be found on the state's website. And there, if you go to the COVID page, there's a testing page, has a map for all the different testing sites. There are 4 drive-through clinics that are set up through tomorrow. None are in Monroe County, but they are in some other counties throughout the state. And so there's lots of different options available for people right now. Indiana's positivity rate is about 15%. Monroe County, our rate of positives among our people tested is 6.2% today. So that continues to drop. That's good news. We feel like we're doing well, and that's encouraging as we look at our next steps. In terms of testing, there's an article in the paper today we released yesterday that the OptumServe site opened this morning, and it will be closed on the weekends, and it will be closed Monday for Memorial Day. However, it is open today. You do need to have an appointment to be seen. There's a direct link for that. It's lhi.care/COVID testing. If you are just interested in the Optum sites, you can go to their online portal directly, or you can use the state webpage that I mentioned earlier, coronavirus.in.gov, and there's a testing page that lists all the different places in Indiana that you can get tested. So we're pleased that there's a lot more opportunities for people to be tested. Guidelines are lessening. We do still want to focus on people who may be symptomatic or at high risk, people who are direct contacts with somebody, people with any underlying health conditions, those kinds of things. So we encourage people to go through those sites if you feel that you need to be tested. The testing hours for the Optum site will be Monday through Thursday, 8 to 8, and Fridays, 8 to 4. And we do, again, encourage people to seek out testing if they feel that they need that, especially people who are 65 and older, who have chronic illnesses or otherwise considered high risk. So we're pleased to make that announcement. I know we had some delays with that before, and we're happy to have that up and going. The state did contract with Optum for those services. That is not a direct contract with the health department or the local government, although we've had a big hand in making it happen and pull it off. The other thing that I want to just kind of tag on, thanks everybody for mentioning our pledge and our encouragement to get people to take the pledge and practice social distancing, washing our hands, not touching our face, doing all those things to prevent the spread of infection, using good judgment. So many of us took that pledge last week. I've seen some other people post their picture and their pledge on social media. Encourage people to do that. The Monroe County community organizations, I always stumble over that, community organizations active in disasters, the Monroe County COAD, is also kicking off a campaign for face coverings. They have named it Wear It, Be Town, and they're asking people to, on Monday, to take a picture of themselves with their face covering on and use hashtag Wear It, Be Town, so that we can get that exposure. To do that on Monday between 9 and 9 and challenge someone else to post their picture as well. And we'd also like you to add a hashtag Monroe County masks. So if you would use both of those hashtags, Wear It, Be Town and Monroe County masks, on Monday, post that picture of you and your face covering. And if you've got multiples, maybe you'll post multiple pictures of that, but challenge someone else. We want to make it more normal. We want people to understand the importance of it. We do have a web page set up. So www.co.monroe.in.us/wearitbtown. And there's information on how to take care of your face covering, how to wear it properly, all those kinds of things, and more information to follow about that. So we ask that you get on board with us. If you don't have a face covering yet, then there's information on how to make one that's on the CDC website. It's on our website. So we would encourage you to do that and join us as we go forward. And I think that I have covered all the things that I wanted to share today.
All right. Thank you very much. So next to Monroe County Emergency Management Director, Allison Moore.
Thanks, Chuck. I'm out delivering some supplies today to some first responders and other organizations. And so I've just hopped on the call, enjoying this beautiful sunshiny day, and hopefully many people are able to do that as well. Of course, I'm doing that with my mask on, and hopefully those that are out and about are in fact wearing masks, as we have said on, I think everyone that has spoke before me has mentioned that we encourage individuals to wear those. Some interesting things just to quickly repeat that have been on the call that I find to be interesting is that we are in week 10 of this. It seems like it's been forever, but we are in week 10 and our numbers are, like Penny said, 6.2 for Monroe County of our population. And I feel like we're 10 weeks into this and have released 100 patients and are at that because we have in fact had residents that are doing their part and wearing those masks, and we just cannot push that enough. And so exciting that we have this campaign on Monday. Our office has been really involved in that campaign that's coming out on Monday. And we do encourage you to spread the word and make it normal, that people will feel normal and not out of place to be out and about and wear those masks. I only have one update today beyond that little announcement that we are continuing to encourage people to wear those masks, and that is we do have a blood drive scheduled. As Brian mentioned, we do anticipate having that shortage. Summertime is definitely when there is a shortage, and when with increasing the surgeries and various things that are now kind of starting back into those hospital processes, we want to make sure that we keep a blood supply for Monroe County. So we have our community Monroe County blood drive scheduled for June 23rd. It's scheduled at the Bloomington Convention Center. It will be by appointment only, and you'll be able to make those appointments through the Red Cross, and they are getting that information ready currently. And once we have all of their information on how you can schedule an appointment for June 23rd, you can find that information as soon as we get it from the Red Cross on our county website. And as Brian said, please start searching now for places to where you can go, but also hold that date and be willing to donate for the good of the cause on June 23rd. And that is all I have.
All right. Thank you, Allison. Next, go to Kirk White, IU's Assistant Vice President for Strategic Partnerships.
Hey, good afternoon, everybody. This was a big week for IU because the recommendations of the IU Restart Committee report were presented to President McRobbie this week and released yesterday. The Restart Committee outlined a phased approach to restarting campus operations with really two overriding priorities. Number one being the health and safety of our students, faculty, and staff, and in turn the community. And number two, maintaining the continuity of our instruction, our research, our clinical operations, all three of those really vital to the health of Indiana and our nation. A key building block in the Restart report, getting our campuses back into operation again fully, is the testing and contact tracing pieces of the recommendations, and now the arrangement that's very unique that Indiana University has with IU Health, and our particular partnership there, which will allow any IU student, faculty, or staff member who is symptomatic to be tested by our IU Health partners at our various facilities around the state beginning on June 1st. As we've all talked before, the contact tracing and testing is just key to how we can maintain the safety and of our population and stop the spread. And so this is a key part of our restarting operations. We're expecting to resume faculty and staff, or faculty and student research projects, and again, slowly, but in a phased approach beginning the 1st of June. And then the report also discusses resuming classes for fall semester in some proportion, perhaps face-to-face and online, with again, extensive risk mitigation, testing and tracking procedures. The report goes into great detail about how we plan to do the risk mitigation and sanitizing and encouraging our populations to do the same thing. The university has contracted along these lines with the procurement through our procurement organization to issue 2 face coverings for all students, faculty, and staff. So those are on order, and we expect those to be arriving soon so that we can get those issued, 2 of them, to everybody who will be on our campuses. As a follow-up to the report, our campuses around the state, and in particular Bloomington, as I mentioned last week, Bloomington has 10 different committees working on Restart. They've been studying this report and these recommendations, and will send their recommendations back to the president for implementation in Bloomington next week. And I expect that the president will then issue further guidance about specific protocols that we'll use to get back up to speed here through the summer and fall. In the meantime, we're encouraging all of our faculty and staff to continue working from home, practice hand washing and the other protocols that we've discussed today. And as I think was discussed earlier this week in a media release, we're very happy that the Indiana population is taking advantage of IU Online, and we've experienced record enrollment for IU Online this summer. That's a great way to take advantage of this time we have sequestered, more or less, and we're glad that people are able to do that. And finally, I'll just say that on the Memorial Day theme, you don't always think about Indiana University at Bloomington as being a major part in your Memorial Day observances, but I'll just remind everybody that both the Indiana Memorial Union and Memorial Stadium were named in honor of IU family members who gave the ultimate sacrifice. And in particular, we have a room set aside that recognizes those sacrifices with a golden book of those who have perished in the wars of our country that we've honored. That room is in the Indiana Memorial Union, of course, not available this weekend, but it will be again, and I encourage you to visit there sometime. Thanks a lot. That's all for me.
That room is spectacular too, and quite moving when you can electronically look through the names, look up names in the book.
That's right, Chuck. It is online. You can look up the names of IU faculty, staff, alums who have perished in the wars.
Yeah, it's just a gorgeous room too, quite fitting. Okay, so we can move to questions. First from Emily Ernsberger from the Herald Times. So this is to Penny Caudle. A few questions for Penny. How did businesses reopening go this week from your end? Were there any complaints made? Oh, you're muted, Penny.
Sorry about that. I didn't press the button hard enough. So thanks, Emily, for that question. I think overall it went very well. Certainly we got comments and we got some complaints and we followed up on those. One interesting note that I would say, some of the complaints that we received were actually not things that people were in violation of. So some of the restaurants, there were pictures and they may have been full at their 50% capacity, but they still had their tables distanced. I know some people complained that there's 6 people at a table, and you can have, by the governor's order, 6 people to a table. You cannot have more than 6 people at a table. So as we followed up, we have been able to give some additional guidance to some locations, things that they could do to improve. Maybe they didn't quite have markings laid out on the floor, perhaps, as well as they could have, those kinds of things. So it was really opportunities for us to identify places and the things that they were trying to do. Some of the businesses told us that they had to ask people who were not complying to leave. So I think businesses are trying to do everything they can to follow the rules. We've heard from them too that, we're glad to be reopening in some cases, and we will do everything that we can to maintain that. In other cases, some people have said they're not quite ready to reopen, and so they're taking their time with that. And that, again, was part of our decision-making process and looking at what we heard from the business community, and that not everybody was quite ready to open. So we did not expect every business to reopen last weekend, and they did not. But overall, I think that it went pretty well. Certainly, some people felt maybe like there was less ideal circumstances than they would have liked. And that's just a reminder that all of us have to be proactive in our own actions, but we also have to remember that people are watching us. Individuals are watching businesses and how they perform and how well they follow guidelines, and people will be deciding whether or not they're going to give their patronage to that business based on that. And, even with other people around you, I think it was Commissioner Thomas that reminded people that we wear our face coverings for those around us, for our family, for our friends, for the people we don't know who may have health conditions, that if we were asymptomatic carrier and we didn't have that face covering on, we might accidentally put them at risk. So keeping those things in mind, and that's why we have the campaign coming. So overall, I think it went well. Certainly some bumps in the road, but I think that people are trying to do the right thing.
Okay, again, from Emily for Penny, it's been reported that I think she means there will be one CVS testing site in the county. Will there be more? Does the health department assist in having those established?
That is a CVS call all the way. Any provider could offer testing if they wanted to. And I don't know that they have any CVS locations in Monroe County, or maybe not in Indiana yet, but there is indication that they are coming. So we welcome people to be able to get tested at as many places as possible.
Okay, one more for you, Penny. What was the reasoning for moving the OptumServe site from downtown to the new location, which the state's website indicates is the National Guard Armory?
It is at the Armory. We have not been really advertising, I guess, the location, because people do need appointments. They need to pre-register before they go. So that's the reasoning for us not to give out or advertise that location up front and in the front line of every advertisement that we do, because we want people to know that it's available, that they need to register online, and then they'll be given that address. So not trying to hide that, just we don't want people to think that they can just stroll up, walk in, and be served right away. In terms of the site, again, the health department is not in charge of setting those sites up. We didn't make, but we were assisting with that. And that's an Optum situation. There was some staffing issues. There were some other things I think that went into that, and we just had to find an alternative location.
Okay, this is from Ethan Burks from WFIU, WTIU, again for Penny. Whose decision was it to close the new testing site on Memorial Day? Was this a difficult decision to make given the demand for testing?
It was an Optum. Again, this is an Optum clinic. We are not in charge of its operations. We would have, on a personal note, I would have loved for it to have been open on Memorial Day, but that was not our decision.
Okay. Actually, not seeing any other media questions. Welcome anybody with media to ask a question here directly on the call as well. We still have about 10-ish minutes left if you want to ask another question. In the meantime, I'll just put a plug in. I think you saw, and those of you on Zoom saw the Restart Committee recommendations report as regards IU, president.iu.edu. Kirk put the direct link in the Zoom chat. But if you go to president.iu.edu, you can see more about IU's plans for potential reopening. And of course, more to come about 2020 semester will look here in the coming days. So any questions from media directly on the call or anything else to put in the chat? Have we started our holiday weekend early? And yes, and Amanda Roach, my colleague, has put an HTML version of the PDF of the Restart report here in the chat as well. And she's posted it here also. And again, another IU plug, coronavirus.iu.edu is an excellent site to find out more about what is going on at IU as regards to these situations. And in that is a frequently asked questions section, which has a lot of nice follow-up information related to the Restart report. My colleague Amanda worked on that directly. And so that is something that you might want to take a look at. And I was stalling here. Amanda has put she put the direct link in there now. We go through several iterations of this and trying to prepare these things, and they're test links. And so this is the actual link. And So it is indeed the weekend, Amanda. So we will leave it there unless I hear a last call for a question here. And again, appreciate everybody. And we will again return next Friday, and we'll have, of course, more to talk about then.
Remember to take the pledge and post your picture on Monday.
Thanks a lot, Chuck. Thanks.
Great weekend. Thank you, Chuck.
All right. Thank
Thanks,
you.
everyone.